The laryngopharynx, a crucial component of the human respiratory and digestive systems, plays a vital role in the physiology of speech, swallowing, and breathing. This anatomical region, also known as the hypopharynx, represents the lower part of the pharynx, which is the muscular tube that extends from the back of the nasal cavity to the esophagus and larynx. This video covers the medical definition and provides a brief overview of this topic. So, if you're ready, let's get into it. Located posteriorly to the larynx, the laryngopharynx functions as a pathway for both air and food, making its structural integrity and functional coordination essential for several critical processes. Anatomically, the laryngopharynx extends from the hyoid bone to the lower border of the cricoid cartilage, where it continues as the esophagus. This placement allows it to act as a crossroads, where the pathways for food and air diverge. The laryngeal inlet, which leads to the larynx and eventually the lungs, is located anteriorly in this region, whereas the esophageal opening is situated posteriorly, leading to the digestive tract. This structure is lined with a mucous membrane and contains multiple layers of muscle that help in the process of swallowing. One of the key functions of the laryngopharynx is its role in the swallowing process. During swallowing, the larynx rises, and the epiglottis, a leaf-shaped flap of cartilage located at the mouth of the larynx, folds over the glottis, which is the opening between the vocal cords. This is essential for directing food and liquid into the esophagus and away from the respiratory tract. This action is critical in preventing aspiration, where food or liquid could enter the lungs, potentially causing choking or respiratory infections. The laryngopharynx also plays a significant role in vocalization. While the primary site for sound production is the larynx, the pharynx, including the laryngopharynx, contributes to the resonance and quality of the voice. It acts as a resonating chamber that amplifies and modifies sound, thereby playing a subtle but important role in speech. Furthermore, the laryngopharynx's strategic location and structure make it a critical area for the assessment of various medical conditions. Issues such as infections, tumors, or structural abnormalities in this region can lead to symptoms like difficulty swallowing, throat pain, or changes in voice. It is often examined in diagnostic procedures like laryngoscopy or endoscopy to evaluate conditions like laryngeal cancer, vocal cord nodules, and other throat disorders. But as you can see, the laryngopharynx is an integral part of both the respiratory and digestive systems. Its unique positioning and structure enable it to effectively guide food and air into their respective pathways, contribute to the vocalization process, and protect the respiratory tract from aspiration. Any disturbances or diseases affecting the laryngopharynx can significantly impact these essential functions, highlighting the importance of this anatomical region in overall health and well-being. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we're not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day, and as always, breathe easy, my friend.